You ask, we listen. One viewer has questions about a decade-old cigarette tax. They want to know if it served its purpose, and if so, what is the money still being used for? So 11 listens and gets answers. In 2009, the Arkansas legislature passed a law to increase the tax on cigarettes, raising the price by 56 cents per pack. A viewer curious to know about the funding it's generated asked if the money was ever used to build a trauma center. If it was, what is the tax still being used for?
It really is funding a comprehensive, integrated system of care.
Trauma branch chief at the Arkansas Department of Health, Greg Brown, says at one point Arkansas had one of the highest mortality rates for trauma in the country. Prior to 2009, it was the only state without a designated trauma center. Once the cigarette tax was implemented, the state began to expand its system.
And what we found is that over that short period of time, we were able to reduce mortality in Arkansas up to 50%.
It's a voluntary system, so hospitals can choose to opt in or opt out. There's currently 61 trauma centers across the state in outlying areas of Arkansas. But it's not just the hospitals that participate.
Our EMS services are also participating every year, and they're funded to make sure these patients get to the right hospital at the right time to get the right care.
There are many components to the state's trauma system. The money generated from the cigarette tax is also used to fund different aspects, such as the Trauma Communications Center, Image Repository, new equipment, and education for nurses and physicians.
The legislature continues to appropriate that funding, and we're very gracious for that, allowing us to support the hospitals and allow us to support the EMS services through subgrants.
Funding that's helping the system function for years to come.
The implementation of a trauma system has saved countless lives in Arkansas just in a very short period of time, and we continue to show improvement year over year.
Well, since July of 2009, roughly $170 million has gone towards the state's health care system from the cigarette tax.